So at this point, I'm going to have my colleague, Dr. Mallin. Again, she's a professor at the University of Florida, and she'll share some of her research findings with you.
Thank you. Dr. Mallin, please proceed.
Thank you for having me here today. Oh, I left my So for today, I'm going to provide an overview of the current state of the science on fluoride exposure and neurodevelopment with a focus on the studies conducted in North America, because that's where we're at. And I have been researching this topic now for over a decade. And I don't have any conflicts of interest or disclosures related to the material in this presentation. So our understanding of impacts on fluoride on neurodevelopment has evolved considerably over the last 10 years or so. Prior to that, there had not been any studies conducted in North America on this topic. In 2012, there was a meta-analysis conducted by a research group at the Harvard School of Public Health, and they looked at studies conducted in other countries that examined associations of fluoride exposure with child IQ. And most of these studies included exposure levels that far exceeded the levels that we're commonly exposed to in the United States. And they determined that the results support the possibility of an adverse effect of high fluoride exposure on children's neurodevelopment. And prior to that, there have been numerous animal studies that have documented the mechanistic plausibility of developmental neurotoxicity of fluoride, showing that fluoride causes neurotoxicity in animals, even at relatively low levels. And so in 2015, I conducted the first human study to examine exposure to fluoridation from community drinking water and ADHD prevalence. And I was interested in this topic because I had read an animal study in 1995 that found that rats that were exposed to fluoride in early development developed ADHD-like symptoms. And similarly, we found from this study that states that had a higher prevalence of community fluoridation also tended to have a higher prevalence of ADHD diagnoses in children. And this was an ecological study, so it was really hypothesis generating, and we concluded that this area warrants further study. In 2017, there was a prospective study conducted based in Mexico City that examined associations of prenatal fluoride exposure with child IQ. And these levels, again, were comparable to the levels that we are commonly exposed to in the United States. The study found that, each 0.5 milligram per liter increase in maternal urinary fluoride across pregnancy was associated with a 2.5 point IQ reduction in the children from ages 6 to 12. This same research group conducted a subsequent study examining associations of prenatal fluoride exposure with ADHD symptoms. They found that higher exposure to fluoride in pregnancy was associated with more symptoms of ADHD in the children, again, between the ages of 6 to 12, and particularly in the realm of inattention. In 2019, there was a study conducted in Canada. This was a nationally representative prospective pregnancy and birth cohort in Canada that included pregnant women living in both fluoridated and non-fluoridated communities. And again, in Canada, the recommended fluoride level is 0.7 milligrams per liter for drinking water, similar to what it is in the United States. They found that for each 1 milligram per liter increase in maternal urinary fluoride across pregnancy, there was a 4.5-point IQ reduction in the boys. And then when they looked at fluoride intake from drinking water and other sources, for example, from tea, they found that each 1 milligram increase in fluoride intake was associated with a 3.66 IQ reduction in the children. So consistently seeing that association, looking at different exposure metrics. And so one of the questions from those studies was, well, these are studies conducted in Mexico and Canada. Can those findings be generalizable to the United States? And so I led a study that examined urinary fluoride levels in pregnant women in Los Angeles County that was published last year. And we found that it was indeed the case that the urinary fluoride levels in the pregnant women living in Los Angeles County were quite similar to those observed in the studies conducted in Mexico and Canada that found associations with lower IQ and more ADHD symptoms. For example, the third trimester urinary fluoride level in the Canadian cohort was 0.77 milligrams per liter, and for the study of the women in LA County, it was 0.80, so nearly identical. There have been several other studies conducted in North America that have observed a similar association of higher prenatal fluoride exposure with worse neurodevelopment. This highlighted one was conducted in Mexico and found that higher urinary fluoride among pregnant women was associated with poorer overall cognition in toddlers. Another study conducted in Mexico found that higher dietary fluoride intake, because fluoride is added to salt in Mexico, that was associated with worse cognitive outcomes in the toddlers. And then another study that was recently published in a Canadian cohort found that chronic exposure to fluoride at the recommended level of 0.7 milligrams per liter for drinking water was associated with worse child executive functioning. So things like cognitive flexibility, inhibitory control were all poorer in relation to that exposure. There were also 2 subsequent studies that looked at domain-specific effects of prenatal fluoride exposure on IQ and found that fluoride exposure in utero may particularly adversely affect nonverbal intelligence, and that boys may be more susceptible to those effects from prenatal exposure, while girls may be more susceptible to those effects from infant exposures. It's also important to keep in mind that all of these studies, they included different exposure measures. So some used urinary fluoride as a proxy for fluoride exposure. Some used water fluoride level or fluoridation status. And some, as I mentioned, used dietary fluoride intake to assess exposure. And again, the consistency in the findings across all of these studies using various exposure metrics. So I've talked a lot about prenatal exposure. What about infant exposure? There was a study that was conducted, again in that same cohort of pregnant women living in Canada, that examined fluoride exposure in infancy among formula-fed and breastfed infants in relation to child IQ. They found that an increase of 0.5 milligrams per liter in water fluoride concentration, which is roughly the difference between living in a fluoridated and non-fluoridated community, that increase in exposure in infancy was associated with a 9.3 and 6.2 point decrement in performance IQ among formula-fed and breastfed children, respectively. So this is from exposure during the first 6 months of life, and you can see from the infants who were formula-fed with the tap water, that 0.5 milligram per liter increase is associated with a 9-point IQ decrement, which is pretty astounding. The standard deviation of IQ scores is 15, so that's nearly two-thirds of a standard deviation. That's like a whole category of IQ. And recently, so in August, the National Toxicology Program published the most comprehensive systematic review on impacts of fluoride exposure on neurocognitive outcomes. This had been years in the making. They included all of the existing literature on this topic. They focused on human studies, but also included animal and in vitro studies to examine mechanisms. They included 72 studies on fluoride and IQ in total, and the vast majority did find an association of higher fluoride exposure with lower child IQ, so 64 of the 72 studies. And they also examined methodological quality of these studies. They determined 19 to be considerably high quality at low risk of bias, and of those 19, 18 studies found an association of higher fluoride exposure with lower child IQ. The authors of the report concluded there is moderate confidence in the body of evidence that estimated fluoride exposure is inversely associated with IQ in children. And they stated that this moderate confidence determination is relevant at a minimum to those living in areas where water fluoride concentrations are at or above 1.5 milligrams per liter. So it's at least relevant to those individuals. However, they said associations between drinking water fluoride levels below 1.5 milligrams per liter and child IQ remain unclear. So they didn't feel they had enough information to make a determination on that. However, they said it was plausible that pregnant women and children living in optimally fluoridated communities could have a total fluoride intake at or above the level of those living in communities with water fluoride levels of 1.5 milligrams per liter or higher, because drinking water, of course, is not the only source of fluoride exposure, although it is the main source. But when combining that with other sources, that can also increase risk of exceeding that level. And so one thing the NTP report also highlighted was a need for more US-based studies on fluoride and neurodevelopment. And I led a study that was published last May that examined prenatal fluoride exposure in relation to infant neurobehavioral outcomes. We found that higher prenatal fluoride exposure was associated with more symptoms of neurobehavioral problems in the children by age 3, including symptoms of autism, anxiety, somatic complaints like headaches, stomach aches, and emotion dysregulation symptoms. In terms of mechanisms, as I said, there have been animal studies now for decades that have documented potential mechanisms of neurotoxicity. They have shown that fluoride can readily cross the placenta and accumulate in the infant brain, or the fetal brain rather. They can accumulate in brain regions implicated in learning, memory, mood, attention, executive function. So all of these processes that are important for our learning and memory and things like that. They can go in and alter neurochemical activity, including cholinergic activity, which is important for our attentional processes. They can increase oxidative stress that can cause cellular damage, and they can alter glutamate metabolism, which is implicated in anxiety disorders. As Dr. Latipo mentioned, there was a federal ruling in the fluoride trial that has been ongoing now for years, and that ruling was made in September, ordering the EPA to take regulatory action concerning fluoride. And the ruling concluded that the court finds that fluoridation of water at 0.7 milligrams per liter, the level presently considered optimal in the United States, poses an unreasonable risk of reduced IQ in children. So the ruling was pretty clear. The ruling stated the scientific literature in the record provides a high level of certainty that a hazard is present. Fluoride is associated with reduced IQ. And as Dr. Latipo mentioned, the ruling states there's not enough of a margin of safety between the hazard level, which the NTP report concluded exists at 1.5 milligrams per liter, and the exposure level of fluoride in drinking water for dental caries prevention, which is 0.7 milligrams per liter. Again, the EPA's default standard is for there to be at least a factor of 10 between the hazard level and the exposure level. And so according to the EPA's default standard, the fluoride concentration in drinking water would need to be 0.15 milligrams per liter or lower to provide enough of a margin of safety to protect child IQ. However, if the hazard exists at the recommended level, which is still unclear, and we see evidence of that in several of the studies that I presented today, then there really would be no margin that would be safe for the child developing brain. Thank you. Happy to take any questions.
Council, do you have any questions for Dr. Latipo or Dr. Mallin?
Yeah, I have a question. I know you mentioned that you've been doing a study on this for decades, did you say?
About a decade.
Okay.
Yeah.
Well, and I was wondering, you know, we have the Florida Health newsletter, the guidance for community water fluorination, written November 22nd. I know you referenced a lot of the studies that were in that report, and you know those were you know, the Canadian and the Mexican reports.
Yes.
One thing that I was curious about, because in the one that was conducted in Mexico, it did have a comparative one, and it did say that additional research is needed to examine whether a specific gravity-adjusted maternal urinary fluoride levels among pregnant women in the U.S. associated with neurological development It says that we need more research on that. So my question is, and I know Dr. Latipo, and thank you so much for taking time to come out and visit us today. You had mentioned that you'd just been researching this for the past several months. So my question is, I mean, do we need to do more studies in the United States to find out a little bit more information? Or, where are we at with the current studies that are going on right now?
So in terms of the current studies, so the NTP report has summarized everything up until 2023, except for the US study that I led. And they determined that there is a hazard or that the association between fluoride exposure and child IQ is inverse. The study that you had referenced, could you remind me which one that is? The study in Mexico that may have included
Let's
more
see, it was
research?
the Mexico City, Mexico study published in 2017.
Okay. So I know at that time, that was the very first study on this topic that was prospective and included relatively low exposures. So at that time, certainly more research was needed. But now there's really enough consensus that regulatory action needs to be taken. And that's the opinion of the federal ruling.
And that was the one from September 24, 2024?
Yes.
Okay. And like I said, like the research that you've been doing, how come nothing was referenced in this letter for that?
In which letter?
This is the Florida Health, it's from the governor's office, and Dr. Latipo is on here as well, but it's the guidance for community water fluorination, it's dated November 22nd, 2024.
Okay, I think some of my studies are in that guidance. Okay, you can.
Yeah, no, that's right. We definitely reference some of Dr. Mallin's studies.
Okay, I'm sorry, I was
Yeah.
looking at that, I just didn't see those in this information here.
That's good.
Okay. Anyone else?
Question on where you said 0.5 increase, what was the base rate?
The base rate?
If it increased 0.5, what was the starting?
Oh, what was their minimum? It's generally around 0.1. I don't know off the top of my head, but I can refer to their table. But yeah, there was generally a 0.5 milligram per liter difference in the urine of the pregnant women who were living in fluoridated versus non-fluoridated communities. That's what tended to differ between them.
Also, in the documentation that he presented, it also says that all groundwater has fluoride in it as well as iron and other things. So people that don't live in the city where we regulate it, they live in a non-area there where they have a well or anything, how are they to maintain a level of not having the wrong level of fluoride?
So that's, yeah. And also, I misspoke. I had meant water fluoride difference between the fluoridated, non-fluoridated communities. But yes, if there's high fluoride levels in wells, that's something to address as well. Those can be quite high, like astronomically high. I've seen 7 part per million. So the NTP report said there's about 3 million people in the United States with water fluoride levels that exceed 1.5 milligrams per liter. So that's an issue that warrants addressing.
Vice Mayor? Just one quick question, Dr.
Sure.
Latipo, as the Surgeon General of the state of Florida, it's your opinion then that the dangers of the fluoride in the water system outweigh the benefits for the public health?
Definitely, like no question. With the information we have now, it's just playing with fire to keep doing it.
Okay, thank you very much.
Well, I have another question then. If we were to lower ours from 0.7 that we have to a 0.5, would that be feasible?
So,
Because we're going to hear from dentists in a few moments, and this was brought to the city of Leesburg Monday night for a reconsideration. And what was brought there was a orthodontist that had found out that the city had stopped the fluoride, but nobody knew it because their equipment broke down, and now we put it back into operation. And he noticed how many people came in with more cavity problems during that time that it was off versus before when it was on.
Yeah.
So, I mean,
Yeah, I'm
I
happy
think
to
we owe
address
it to the
that.
public.
Sure, yeah, I'm happy to address that. So earlier I mentioned that, and this isn't to discount that dentist's experience. Earlier I mentioned that one of the arguments or defenses you hear is that there's a factor of, the levels that have been shown to be harmful are twice as high as the levels. And hopefully it's very clear from Dr. Mallin's talk and mine that twice as high is too close to what is known to be risky. And moreover, our levels have been found to have risk with them. So hopefully that addresses, that addresses that argument. In terms of the argument that if you stop fluoridating, people's teeth are going to be falling out of their mouth. The best studies, and the American Dental Association even quotes this number, they estimate that there's a 25% reduction in dental caries. Okay? So I'm not discounting any dentist experience, but anyone who says that, we stopped doing it and now teeth were falling out of people's mouths from all the cavities, that's not consistent with a 25% reduction in dental caries. Again, not to discount anyone's experience, but to attribute that experience to water fluoridation isn't supported by the data. Moreover, as I mentioned, there's a Cochrane review from some years ago, pretty recent, I think it's been in the last 5 to 7 years, that actually raises a question as to what the benefit is now of water fluoridation, because so much has changed. Most of the studies that showed a benefit were pre-1970s. There was less availability of fluoridated toothpaste. Some of our education and knowledge about dental carie prevention was less sophisticated. It's just not clear, according to the Cochrane review, and their gold standard resource for systematic reviews, that the benefit that was seen decades ago from fluoridation in terms of the dental benefits is still present, particularly considering the other sources of fluoride in toothpaste. So I don't think 0.5, I think that doesn't make sense. I think, frankly, Dr. Mallin mentioned that actually there may be no safe level of fluoride. The EPA's reached a similar decision with things like lead. So with lead, for example, the EPA says, and this has evolved over time, that there's no safe level. So the right amount is 0 in water. Because, even at lower levels, there's enough evidence that there are, with lead, there are neurologic effects. It's clearly neurotoxic. With fluoride, it's probably going to be similar. I mean, maybe it will come out to be 0.1, but frankly, it probably will be similar in that the level that's safe is just, is none.
Okay. All right. Thank you so much, doctors. Appreciate you coming to Tavares. Thank you very much. We are very glad you came and shared your time with us. Thank you.